Hello, everybody. Good morning. Anatta is back again with part two of its episode of sexuality related with addictions. Last time in part one, we saw that we touched upon a lot of topics which literally changed the narrative of how sexuality is addressed in society. And we dispelled a lot of myths and we gave a lot of awareness to whoever was watching as to what was sexuality, what is sexuality, what are the possible repercussions of childhood sexual abuse, marital rape. We covered a lot, many topics. Now, here in part two, we are going to be focusing completely on addictions and how sexuality is affected in somebody who's addicted to substances like alcohol, drugs, or prescription medications. We have with us Dr. Rajiv Jerajani, who has a 40 plus year experience in the field of addiction treatment. And sir, good morning. Welcome today, back again. And let me right away dive into the topic. And so, could you please elaborate on what are the various addictions that are present in society related to substance use, especially?
Well, two ways I would want to respond. When we talk about addiction, 90% of the people understand that we are talking about substance abuse. But to me, addiction is not nothing to do with substance. Addiction is more about the person. See, primarily, the substances can be defined into different categories. But when it comes to addiction can be not necessarily only chemical dependency. It can be any particular behavior, which addictive behavior is a product of addictive logic.
Correct.
However, since you mentioned that substances, so primarily very practical classification. I am not going into international classifications and guidelines provided
Mhm.
by all of them, but simple practical understanding of classification. There are three categories. One, which is alcohol. Two, which is tobacco based, and three, it is the substances or drugs. Now,
Mhm.
in drugs, there are two categories, one which are licit or prescribed drugs, and one which is illicit, which are available on the roadside in a black market. Now, one is within the legal framework, but more than often, those which are within the like tranquilizers and minor sleeping pills and things like that, they are all under schedule. But people do get prescriptions and they overdose themselves. The question is that when we see this larger capacity, it is one way of classification.
The question
The
is
other,
that
sorry,
Yeah, nothing, so you can go ahead.
the other way to classify that there are those who enhance the mood, which in street language it is called as uppers, and there are those who makes the person calmer, which we call downers. The third category is supposed to be hallucinogenic, means it creates a visual and auditory altered perceptions wherein the person can hallucinate. So these are the three categories classification of the drugs, which are practical way of when you are looking at the patient, you may be wanting to put it for the legal purposes, the classifications which are used. Like example, Diagnostic and Statistical Manual of American Psychiatry Society, it has a notification that this is not to be used for legal purposes. You cannot use it
Okay.
for legal purposes. Okay. So classification, these are major, I would put it that way, alcohol based, tobacco based, and substances. In substances, two categories, the licit drugs and illicit drugs. If you want further little bit elaboration, Then prescribed medicines predominantly are antidepressant, anti-anxiety medications, the major tranquilizer, mood stabilizer. There are a number of them. Okay.
Right.
And those which are available on the streets can be from any group, which is like cannabis group, opium group. There are ephedrine derivatives, there are hallucinogens like acid and things like that. So commonly we see all these kind of in our country for sure.
All right.
Yeah.
Thank you, doctor. So, coming to the next aspect of the question, which is very predominantly seen in most of our clients, is that there is a very strong link between addiction to substance or substance use and sex. Could you please elaborate on that?
They look, one must understand that as I in last communication I was talking that the pathology is defined by hyperactivity or hypoactivity. Now, if the effect of drugs is to stimulate, then it will enhance every aspect of life, including sexuality. If one wants to slow down, then again there are medicines which will, bring it down. Hypersexuality can be reduced by
Mm,
tranquilizers. The question is that addictive logic, which the focus should be, is on the experience of consuming the substance which is stored in his mind. And by default, human nature, we are all hedonistic people. If we like something, we want to do it again. I'm happy, I want to be more happy. It is that kind of concept which would result into the addictive logic. Now,
mm,
when person uses this addictive logic in terms of his mood enhancement, simultaneously he also gets the sexual activity enhancement. Now, what increases is the thoughts, emotions, and feeling of good when he takes an upper, a stimulant. Now, the question is that which one is more important? The effect, if there is a pharmaceutical substance or illicit substance. The interaction with human species would remain the same. Whether
right.
you take cannabis in pharmaceutical form, now I'm sure you have heard about the newer oils which are coming off the cannabis oils.
Yes.
And people claim that they are not drugs. Now, the point is that it is not the pharmaceutical manufacturing or the mixed up and, coming from the plant made in the local labs. So, the effects of that substance on the person is going to be same. Like example, I'll give you, say alcohol. What happens to the sex life? Well, if you drink in minimum level, then the desire increases. But for those who are suffering with illness, that minimum level doesn't remain minimal level. So it keeps on increasing. So what it does that it increases the desire at the mental level and takes away the performance. Now this is on the mind side.
Right.
Also on the side of body, it is going to be affected. Like a person drinking alcohol, autonomic nervous system will definitely get affected. So the erectile dysfunction, if at all, it can be one of the reasons is alcoholism. This is directly. And then there are indirect phenomena
Mm,
where the alcohol use for a long period of time results into damage to pancreas, develop diabetes, and diabetes also can cause problems. Which
Right.
way? Same autonomic neuropathies, and the diabetic patient also can experience this part of the story. Now, most of the time, these are dual diagnoses where you have an alcoholism, you have some other illness, and jointly it would affect.
Right.
On the other way around, if you say substance like coca base, cocaine, it will increase the desire and it will increase the performance. But this is the myth which people harbor in their head.
Okay.
There are no aphrodisiacs. It is when it's more of a mental process in that person, thinking that since I have taken this substance, I am now experiencing a high and therefore I should be able to perform better. But it does not mean that, you see, sexual interaction with another partner is not being WWE wrestling. You don't need a kind of physical partner if both of them are cooperative and with consent. The sexual experiences should be beautiful. But then that is where the addictive logic comes into the picture that no, I want to have a good sex, and good sex defined by the powerful sex and long sex, etc. etc. So both example, if you see, of course, each one of them has its own, level of effect and things like that. But yes, it can cause damage to the sexual function, and that is for sure.
Right, doctor. So one is damage to the sexual function that happens with the use of alcohol and drugs like cocaine. However, would you please elaborate more on how does it affect the risk behavioral aspects of using substances? Like
Right.
that is something I think people really need to know because that is sidelined when one uses these substances in an addictive proportion. So could you please
Very good.
elaborate?
Very good question. This is one of the very good questions I would put because it has got two connotations. One
Hmm.
you mentioned is the risk behavior, and second is risk perception. Any addictive logic, it is look, I would say if the 15% of the population, it's a large number, 15% of the population, if it is doing some or other addictive substances, I am looking at little differently that why 85% are not doing it.
Hmm.
So
Right.
where did this whole issue came up? So as you said, that it is the risk perception. If the risk perception is high, then the risk behavior will be low. And if risk perception is low, then the risk behavior is high. Say take example in use of substance. Normally addictive person has got an issue. Two things happen. One first thought in his mind is नहीं यार मेरे को कुछ नहीं होगा, nothing will happen to me. And second is I will manage. I know it. So there may be partial insight that there is going to be a problem, but he is thinking that okay, I am going to handle myself. There is no issue. I have no problems. Now, what do you do about these people? That is addictive logic. Now,
Hmm.
for our species being hedonistic, pleasure loving, and therefore connected, even the sexual activity is a pleasure seeking. Last time we talked about reproductive component and recreational component. Now, in recreational component, of course, it is a pleasure loving activity. So, therefore, you know, how it will happen is that the presumption is that it is going to make me feel great for a longer period of time. Well, it doesn't happen that way. Now, let me use the same analogy little differently. You want to have sex, and your sexual partner, you have been having relationship for some time, not long enough, but some time, or if it is a paid sex, if the person says that I'm HIV positive, how many people are going to have sex with it? Now, that is the matter of risk perception. That when I perceive risk, I will not do an action. 99.9% people will do it. But then there are some people who have addictive logic and they put priorities on having the pleasure more so. And therefore they will say, no, no, I will use condom, I'm safe. I know it. Nothing happens. Now, this is classical self talk in addictive logic. So, the point is that if the risk behavior perceived, say in kind of drugs, 90% more probably, they don't think, nobody, look, probably I've seen 1.5 lakhs patients in my 50 years of life. And I have never seen a patient who says, oh God, please make me an addict or alcoholic. No, it begins with an issue of experimentation, experience, pleasure loving experience. And then it becomes an illness where they just can't stop. By definition, in terms of addiction, they can't stop. And that when he gradually develops, his risk perception is low, so the risk behavior increases. So it is a reciprocal proportion. I hope I have given an answer to your question.
Yes, yes, doctor. You have beautifully responded to that answer, to that question. Doctor, if you could, we have spoken a lot about addictive logic multiple times, and I think a lot of people out there who are watching us would like to know what exactly is addictive logic.
A good question again. Uh, before we know what is addictive logic, we have to know what is logic, because there is deductive logic also. There is a information, knowledge, epistemology, in epistemology. There is a knowledge about knowledge, and logic is something which is a result of resolution of conflict. When person is saying something which is practical and true, people say, yeah, yeah, this is a logical conclusion. So logic is something like that. But addictive logic, okay, in our language we say that when the person has king baby syndrome, it's an addictive logic. It means what? The patient has got temperament which is driven by that pleasure loving activity, and it has resulted into I want what I want it my way. That is one part, which is the king's part. And the baby's part is one where he says, I want it now and now and now. And the second party will say that, look, if I don't get it, I will start throwing tantrums. I want it, I want it. See, that is what is happening, even in sexuality or in any kind of. You see, addiction, again, chemical dependency is one part. But I do quote a number of times, I have said this to number of friends of mine, that my professor, Dr. Joshi, he used to teach, and I always quote him that it is charas, ganja, aphi, bai, batli, patta, goda, satta, randi, bhai. That means it is not only the substances, it is the sexual experience, gambling, all kinds of any behavior where there is a tendency to increase the quantum, to need to perform that activity, which will make you feel great, and in absence of that activity, a person starts feeling uncomfortable physically, mentally, socially, spiritually, whichever way. And this sense of discomfort is sufficiently large that it would result into impaired life, unmanageable life. So, by that definition in itself, that addictive logic is that I want and I want more. The question is, when does it stop? Or what is good enough to make you feel happy? And it is very typical in terms of psychiatry, we say that if he wants to perform from 30% to 50%, it's good. But when he reaches 50%, this move will have 70%. And then he will try for this, and then it will go to 90%, and then absolute percent. No, it doesn't happen. But that in itself is an addictive logic that I want more. And if I don't get, then I become uncomfortable. Now, this is how I look at it. That addictive logic is defined as logic which is addictive. Addictive means increase in quantum, increase in frequency, increase in duration. That is how we define pathology. Everybody has got addiction component, but there are some where it is aggravated or exaggerated. Yeah,
Right. Right, doctor. Thank you for that explanation. Now, doctor, the thing is that when we speak of addiction, there also comes in pornography, wherein pornography is considered somehow as mythically a myth, definitely, that it is educative sexually, because unfortunately in society, sex is not spoken about very openly, sex and sexuality. And a lot of people get into this misconception that pornography is normal sex. Could you please bust that myth today, and how addiction to pornography is also a growing phenomenon seen especially during the lockdown in COVID times? So if you could please
sure,
elaborate that.
sure. I would suggest that you be on the screen. Request your these
Yes.
people
All right.
because it's better that way. Okay.
All right.
Now, pornography. Now, 90% of the time, when it comes to subject of sexuality, this social inhibition which we experience will come forth. That we are not
Right.
supposed to talk about it in public.
Right.
But what is reality? The reality is that, say, pornography, it's an industry, either
Right.
legit or illegal, but it's an industry. And how much do you think that industry is worth? If you put top 10 people riches and calculate some of it, that is kind of business which they are doing.
All right.
All right. The point is that with the, when the technology increased, then pornography, it's a business for those who create that part of the story. Now, obviously, if there are some people who think because they have understood that this is something which has been socially inhibited, but individually everybody wants sex in some or other form. The difference between sex and sexuality is not very clear in people's mind. One is physical, one is emotional, and both of them are complementary to each other. The point is that as of today, everybody who gets into any kind of sexual desire, he has got likes and dislikes. Now, when you say likes and dislike, means what? The male component is one aspect, the female component is another aspect.
Right.
And I'm not yet going into third gender because now it is even that is acceptable. Now, everyone has got fantasy, and the people who create this business, they do hell of a lot of research. It's a hard work to create a business. So, what they do, They kind of understand the needs, desires, and ethos of the clients. You have to know your client. KYC you have to fill up. So this industry also it does the same thing. So they create based on that research. There are choices which you can have. Now I'm being very direct that commonly men has got desire where they are fond of big breast of the woman, or they have got long legs of the women, or they have got very shapely butt of the woman, which in their mind that is the kind of concept which they are enjoying. And therefore they do go on internet, they click onto the site, and the options which are offered to fulfill the fantasy of that person is humongous. So you think about anything, and I'm not saying it is legal. Even the child pornography, it is there with all kinds of options which are there. The question is somebody, I think
Somebody
Vandana
has
is
asked.
asking, yeah, Vandana asked this question whether it is good or bad. Well,
Yes,
that's $1 million question. And $1 million question means what? That there is one, no, nothing is absolute. Trust me on
right,
that. The point, as we defined last time, that if the intensity is high, duration is long, and frequency is increased, then there is a problem. Like
right.
pornography can be a source of entertainment for two people who are married. They want to stay together, enjoy, so that they get little stimulation. They respect each other's needs, desires, and they click on those kind of fantasy. Because try and understand, any audio and visual stimulation will help generating those hormones required for excitement. You know, it is like somebody touches you. In your mind, if there is a sexuality, then you will feel it. But
Right,
that's exactly where the education to small children is necessary. That this is a good touch and this is bad touch. This is already discussed. The
yes,
question is that is pornography is good or bad? Well, it is like asking question that look, I mean, what is this? This is a pen. Is it good or bad? Good. Okay, eat it.
it's a pen.
You can't
Hmm.
eat it. It's not meant for eating. So sexuality and pornography, it's a business. The choice of going into technology and selecting a porn site and finding out and spending time and waste of time for say 5 hours, 10 hours a day, well, there is a problem. Because that is not only the content of it, it's the screen harm which is you are doing to yourself. Whether it is phone, whether it is your iPad, your tabs and your laptops, and any form of screen is going to hurt.
Right.
Again, going back to that whether it is right or wrong. Right and wrong, good or bad is a retrospective analysis. It
Yes.
happens, and then you realize that, oh shit, this is not good. The question is that in terms of psychology, there have been number of cases who have been using pornography for sufficiently long period of time, and even at the young age, they come with this sexual dysfunction. They
Okay.
have difficulty because they're in their mind, they have set up an image of someone which he has seen on the screen. And he is expecting the same thing from the sexual partner, which is nowhere near true. He has seen it that it should be done that way in that, business making my industry. And here is the reality, which is very different because the spouse says, are you nuts? We are not going to do this. Now, that is where it creates the conflict. The question is that look, if the pornography was not used, then it would not be a billion dollar, multi billion dollar
Right.
business. But it's the human nature to see, experiment, enjoy. This is the kind of thought process which is there. But, well, on one side, there are social perceptions which are saying, no, don't do it, don't do it, don't do it. This is not good. The parents are threatening children when he touches his penis. Well, that's one side. The other side is he himself, which is, oh, I'm enjoying this part, why not? And that would be harmful. To create
Right.
that conflict within yourself, that whether I should watch pornography or not, you should be aware that look, if you watch pornography, that porn star is not your wife or your sexual friend or maybe your girlfriend or even a boyfriend.
Yes.
So that conflict in itself, if it happens in mind of the person, well, it's definitely not good. Whether
Right.
see
And how
my
would
yeah, go ahead, please.
so how would you address that conflict? That is where I believe the treatment aspect comes in, the therapeutic part of it.
Correct.
That because
It's like
the
any absolutely correct. It is to be treated as we deal with the addictive component of it.
right,
That look, I'm not telling you to, I'm telling you not to watch. Do you think that he's going to listen to you? No, it won't
no,
happen. But to give him that insight, which results into understanding that actually this is what is happening. Even if I have had couples who come to me for counseling and they would ask this question. And the female has got the same complaint that he watches pornography and he wants to do the same thing to me, and I am not ready and happy about it. Now, I would say
right,
that that would create a conflict for sure, and that results into problem with both of them. He is not happy, she is not happy. Why they are not happy? Because both of them are not getting what they want.
right,
Now, that is what is addictive logic. If one person is giving, this person is receiving. If they are comfortable doing that, then there is no problem in that relationship, whether sexual or otherwise. If both, say A is giving and B is receiving, or other way around, they get used to it, no?
right,
So when the giver wants, this person is not trained to give, and that results into problems. The question is
right,
whether good or bad. Well, so many youngsters have come and asked, she is my girlfriend. Do I have sex or not? So, how should I respond? That is the question. Do I say your parents
hmm,
know it? I asked that question. Do your parents know about it? He said, no, no, no.
hmm,
So I said, do you think you should take their permission? So he said, no, I don't want to. Now, try and understand the communication pattern. The one side,
right,
what you are doing is creating that ambivalence.
right,
Whether it is right or wrong is a choice which you don't make for your patients. You can give them the factual phenomena, you can make them aware of individual perception and social perception. You can tell them to be happy. See, look, in Anatta, we talk about alternative life therapy. What does it mean?
yes,
It means that here is a person who gives, here is a person who also gives. So if this person gives this person and both of them give each other, then life becomes meaningful and happy. That is
Right.
exactly what the understanding about pornography. It is an addictive behavior. I have seen hell of a lot number of patients. Quite a few of them have come by training themselves in terms of gradual reduction or just shut down. Whenever that time when he feels the desire to perform sex, that is the time we talk in terms of help from the codependent. Sex is also addictive. There is no question about it. So when
Yes,
we
sir. So
say
how?
that, yeah, yeah, go ahead, please.
So if you could go and elaborate on that,
Mm,
from pornography addiction, and the next aspect would definitely be addiction to sex, because people do not understand when this line is crossed. How does one identify that one is addicted to sex in
yeah,
males and females, and then how does
yes,
one take help for the same?
correct. Now, well, sexuality is sex act in itself is nothing difficult. It's the sexuality and the fantasies associated with thoughts, mind, definition of pleasure. It creates complications. Now, say a patient, when and how does that realize? See, when does a person realize that I am drinking too much? Unless they develop some kind of complications, unless they develop some kind of problems. Now, what happens by in terms of when the men are watching pornography? They spend time. They want to be alone. They don't want anybody else in the room to disturb them. It results into masturbatory activity or otherwise. The purpose of having pornography ultimately needs that they want to experience that ejaculation. Men.
Yes,
So
yes,
also, in other way, in a simple terms, I'll say that we did discuss about the four phases in last session.
yes,
Or and the fortunately, Dr. Sood also spoke about that. That there is a period of foreplay, there is a penetration, then there is activity, and then there is orgasmic. Orgasmic के बाद में there is a resolution of that excitement. Now, in very simple terms, what is the purpose? Why does man want to masturbate or a woman wants to masturbate? Because they want to complete that act in terms of experience that sense of orgasm. Whether it is done manually or it is done sexually with one partner or more partners. There are
right,
no rules. The question is if it happens, but as I defined pathology earlier, it is the same thing. Increase in frequency, intensity, and duration. If it is coming in your way, in your day to day life, then there is a problem. And this
yes,
kind of
doctor.
problem, for this kind of problems, it is the therapist should be skilled enough to be objective without blaming neither of them and find a resolution of conflict where both people can come on the same page. All right.
Right, right, doctor. See, so sexual addiction or addiction to sex can result in issues of communication between two partners. At the
Right.
same time, it also could mean that one partner, the person who is addicted, could be having multiple partners. So, in what way would communication and relationships be grossly affected in this way due to this?
Yes. Uh, when we see most of the time the female, see, unfortunately, we still understand psychology. Uh, the role of men is to provide and protect, and woman's role is nourish and nurture. Now, this
Hmm.
is archetypal thought process. With time, things have changed. When people used to say that woman is supposed to manufacture babies, which was so stupid, in current situation, it doesn't make sense.
Right.
So therefore, the love, like, and respect of self and the other partner will result into better relationship. Now, the conflict which you described, that they are good in their relationship, yes, and still the man has got number of sexual partners. Well, it's not uncommon. I'm not justifying reason. See, it is a social perception of you know, monogamy, which
Yes.
has been recommended everybody, everywhere, all religion, etc., etc., is a social perception. But what is the reality? The psychology says that given an opportunity to conduct a undetectable crime, because they are hedonistic, they'll do it. Likewise, from early childhood, they have been told, nay, one sexual partner, and still this person is doing. So the question is that that's him.
Right.
I have seen people getting married and for the same reason getting divorces within, say, a month of marriage. So then,
Mm.
when they come back before they go into court, they come to see me because I call myself divorce counseling, not marriage counselor. Because in their mind, they are looking at divorce. So I'm counseling for their problems of divorce. So I'm a divorce counseling. That reality remains. 90%, as you rightly said, the communication. In 12-step programs and our treatment, we follow how to go about doing this. And that's when I say HOW. H is for honesty, O for open mind, and W is for willingness. See, Anatta, we have worked for long period of time,
Yes.
following the fundamental basic nature understanding. And trust me, every single patient is my teacher. We have always learned something different. We sit, we analyze, we kind of work on it,
Yes.
the more
Yes.
understanding. As far as female is concerned, well, they are emotionally extremely sensitive. It doesn't make
Right.
them more. It doesn't make them more addictive. No.
No, that is true. And it is also what place is in a female psyche. Say the female is the one who is addicted to sex or substances, and the resulting risky behaviors that follow that. The effect
Yes,
on that female's mind could be very different from a person who is a male who is
male.
addicted to substances.
That's
Could you
right.
please throw some light? Could you please throw some light on that?
Well, I tell your technology guys, you remain on the screen.
All right, I shall.
All right. So the point is that look, male and female is the distinction which is complementary to each other. All right. There are a lot of myths and misconceptions about it, but I feel independently, individually, that these both people are rational, intelligent, and emotionally sensitive enough.
Right.
That is the purpose. See, look, what happens is he has got polygamy. He wants to sleep with five different women. And she is expecting, no, 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 he should sleep only with me. Now, what
Yes.
happens as a result? Either this person, doesn't get what she wants, and this person is doing everything, hide and do it on sly and not communicate, and that would create more complication. See, relationship is supposed to be, look, it is like simple. Two people try sexuality also, you understand, in terms of relationship. How two people get to know each other? Any two. Hey, you look at somebody, he looks at you. And there are a lot of filmy songs, Nazron se Nazre Mili, Vagera Vagera. Then what happens? Nobody has been able to understand. They like each other. Now, they like each other means it is based on the information stored in their own head on the previous experiences which they have, visuals, kind of out of 20 men you see, you don't like all of them. You may like one of
Right.
them. Likewise, it is something when they look at each other. After that, what happens? You smile.
Yes.
One person will smile, the other person also smiles out of social courtesy.
Hmm.
And then it happens that's it. And they went away on their own. There is no question. There are no problems. But
Yes.
if it happens again, that
Hmm.
they met at some other party or common friends and etc. and they got introduced to each other.
Hmm.
Then they become friends. Then they fall in love. And then they have become one by having sex or otherwise.
Yes.
The point is that at what level, what happened? He was giving what she wants, and she was giving what he wants, and God has been kind. Yeah, everything went well. But it is only after that, if the issue starts, that I want to have a relationship with 5 women, or she says I want to have a relationship with 5 men. Now, unfortunately, socially unacceptability is there, and that is also reality. Unfortunate legalities are also there. That
Yes.
if you do it like this, there are a problem. This kind of relationship is not acceptable, which is there.
Yes.
So then what happens is that both communication breakdowns. He starts getting angry and she starts crying. But
Yes.
getting angry is throwing out energy outside. And crying is getting angry on one's own self. कि मेरा ही नसीब फुटेला था. We were so happy, and by that time, if they have 2 children, then marriage becomes one of the biggest legal issue. Then the child custody comes into the
Absolutely.
picture,
Hmm.
social images comes into the picture, all kinds
Hmm.
of this.
Hmm. 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 Hmm.
There is a question there which says
There's a
behavior.
question that how does one's sexual attributes and behavior come in the way of a couple's communication?
This is what we were discussing.
Correct. We
The
were exactly
point is,
discussing that.
either you accept or you reject.
Hmm.
It is a
Hmm.
role of a therapist to come and explain to both of them, and all three of them comes on the same page. Oh, trust me, I have seen people wherein in social perception they are like Ram and Sita, Jodi, Adbhut.
Yes.
But behind the social scene, they don't even talk to each other. They don't sleep in the same room. They don't enjoy each other's company. I've seen that kind of. But that is the choice which they have made. I've
Right.
also seen people where the men has their own girlfriends and the women have their own girlfriends. And they are comfortable about it. Which we, in our terms, we use open marriage. They know about each
Yes.
other. But there are enough number of people where they don't want to discuss this part. And this is where your patience, your understanding of the total picture, like example, if somebody is staying in joint family, it is usually not seen. But then there are in nuclear families or small families, you do see it. In middle class and upper middle class families, you will see more often. In rich class, nobody's bothered. If everybody is having what they want to do, they get it and they do it. But when will person come to you? When they identify the conflict and they can't solve the problem. So the way of life, unless the person is willing, how is it going to change? So then both of them will sit in front of the therapist. They'll discuss the issues. They will try and come and find a common answer to what should be done.
Hmm.
And if they agree, You bless them. Simple. If they
Correct.
decide that we don't want to agree, we want to separate, you still bless them.
Right.
It's okay.
Correct. That's true. So, doctor, to put it very simply, it is the conflict that is the issue. Otherwise, the paradigms of marriage is changing as society
Very,
changes.
very,
It
very
is
much.
no long, it is no longer what it was earlier that you marry
No, it is.
somebody and it is entirely monogamous. There are different paradigms, and each couple arrives at their own comfortable
Right.
paradigm, and no third person has any business in commenting about it or being judgmental about it. That is the
Oh,
way. If
trust me, I have seen that no, the person having multiple sexual partner, not necessarily male has to have female. It can be male
Of
to male
course,
and female to female also. It is one
of
female,
course.
one male. Number of combinations are there.
There are
The
so many permutations and combinations.
issues of communication remains, and
Correct.
if they are not on the same page, then there is a conflict.
Correct. And in that conflict is something which is unhealthy for someone who's suffering from an addiction.
Right,
Because then resolving that conflict should be the primary aim
right.
with
So
with
therefore,
help of a
no,
therapist.
I'm happy that you made this mention. See, when we are treating everything together. To focus is
Yes.
on the person. It's not that I'm only treating the substance and I'm not touching upon rest of it. It is not only this part and not touching this part. It is everything. The total change of alternative means in terms of everything in your mind, body, in the day-to-day life activity, lifestyle. The change of
Correct.
lifestyle, you know, that is what we do. And well, God has been kind. Lot of people understand that part and they do it. Yeah,
Yes, and they are doing it and they're being cooperative with that because
yeah,
we at Anatta believe in allowing the person to experience that life
yes,
change which we are talking about while
right,
they are in residence with us in our residential programs. So that is why our program, when though we call it an alternate life therapy program, it's actually wanting to live and enabling the individual to live the life they always wanted to lead in a conducive environment so that they can do it and experience it without the use of substances. So, coming back
absolutely.
to, yes, doctor. So, coming back to a very simple term, if you could explain in very simple terms, what is the difference between sex and sexuality? This is a question that has been asked. Also, if that could be highlighted.
Interesting question again. Sex is very simple. You have inherited that component by default
Yes,
because you are a living organism, and in terms of evolution, you have to understand that every species propagates their existence. Otherwise, they become extinct. So, sexuality or reproductive component is by default. The method may be different in different species, but at least say in humans, it's a male female, kind of come together, and what used to be taught in early schools, spermatozoa and ova, they meet and the child is created. Well, that is sex, is the
right.
component of physical activity for the purpose of reproduction. It is simple. The problem is on sexuality component, because 90% of the people don't even think of that. It's not necessary that having vaginal sex means sex and not sexuality. Love and lust are the complementary component of the relationship. If there is no mischief, naughtiness in the relationship between two, I always say that look, husband and wife, very good. But are you friends? Is the communication better? Are you worried or do you care for the other person? These are the kind of questions which I ask, and they are surprised. No, no, we don't have to. I said, what nonsense? Both of you sit together and work out. What is the kind of time that you want to spend together? I'm not saying that you don't have your time or your time 24/7. I don't expect. Somehow they start thinking. Now, I'll give you an example. Sexuality is something like, okay, I have my girlfriend whom I take for a drive to Khandala. All right. We are not having
Mm.
sex. She
Yes.
knows it, I know it, we are not having sex. But we enjoy that company without feeling any sexual attraction, even if it is togetherness. Today, okay, let me ask you this question. When mother feeds the child, does she feel sexy? Or she is experiencing because of oxytocin, love,
It's because of the
the feeling of
oxytocin.
love? Yes.
Yes.
But then this is where the technology and understanding came into the picture. That it is not only, it is endorphins, it is oxytocin, serotonin, dopamine. There are a lot of studies which have been done. So the sexuality is perpetual. It's 24/7. And I don't know. Osho, take example. He was one of the most misunderstood contemporary mystics because his concept on sexuality was not perceived by social circumstances at that time frame. He came probably 100 years before his time.
Absolutely.
The question is that look, if two people they want to do what they want to do you think they're going to take a permission? Well, it doesn't
No.
happen. So the point is that sexuality is a sense of pleasure associated by interacting with another person. And the best example I'll give you, it is I asked the person, your friend is coming from US and on the airport you have gone to pick that person up. How do you greet that person when that person is coming back? And everybody says, yeah, we give a hug. Now, they are not worried about social perception of 5,000 people standing on the airport. It makes no damn difference. Now, that spontaneous relationship, it is sexuality. It's beautiful. The point is communication. And it does not happen unless both people are in agreement. That is how I look at it. That I may love you very much, but if you don't love me, then sorry, it is not acceptable.
Right.
So that communication, clarity in mind, your mind, another person's mind, coming at the same page, and willingness, honesty, open mind, willingness. If we do that, the things will definitely change. See, in the new times, if only an ancient philosophy is there. Lord Shiva was Shushupta. It is
Yeah.
Parvati who came and gave Shakti. So
Correct.
without that, that relationship would not be there.
Absolutely.
It would not be there. And the concept which is there that the father who is supposed to protect and provide is growing old of the little daughter, therefore he finds another person who is supposed to be called as husband. We say that alcoholic father, that girl will find alcoholic husband. Somehow,
Yes, if it is not resolved. If it
they
is not
observe.
resolved.
Right.
Yes.
Now, this is what is the inheritance in terms of sexuality. It's a
Correct.
understanding.
Yes,
I
doctor. That
believe
was such a
there is only one rule. There are no rules.
yes. That was such a beautiful differentiation between sex and sexuality, doctor. Another very important part of our discussion would involve that where in addiction, where a lot of relapses or most relapses are seen because of a sexual connotation. So, if you
Correct.
could elaborate on that and how important it is to resolve one's sexual conflicts related to sex and sexuality when one is addicted, has an addictive personality, how important it is, and how do we deal with these?
Oh, it is one of the very important concept. Over a period of time, I have observed invariably, the addictive logic which is used in substances also is linked with the sexual performance. We have observed. The point is that is he able to talk? Is he able to understand? Does he want to make changes or not? That is the question. Now, relapses, which you said, it is based on. I said that why did he start? That is the question. If he has started drinking alcohol, what happened? Why did he start? It may be very innocent, fun, party, school, peer pressure, whatever reason people give, it is there. But there is something which we have to probe in terms of his social. See, for 14 years I was Freudian
Hmm.
before I started my other work. And libidinal energies are to be respected. You cannot not respect that aspect. If you are saying that I'm a psychiatrist and I'm treating the patient, I should be aware of the basic conceptual framework. I always advise people who have worked with me and who have, studied with me, I say, read everything. Patient has got 200,000 different kinds of problems. Read. So here we are in a situation that how we manage the situation of communication in terms of relapse. Yes, why did he relapse? There are triggers, there are incidences, there are thoughts, there are emotions wherein he is finding the intoxicated state better than reality.
Yes,
Now, what we are doing is to create a reality which is better than intoxicated state. Nobody is forced. Look, when the patients are with us, the only one responsibility which they take is themselves.
correct.
The methodology which you use is a different
Correct.
kind. And as
Right.
you mentioned, the question is that sexuality, uh, is it a significant factor resulting into relapse? Well,
Yes, whether it is sexual fulfillment or whether it is lack of it.
correct. But I am saying that the experience of sexuality, what is registered into head of that person, it has not been happening when he is under influence or is when he is using it. But when he stops using, his overall body and mind functioning improve, he can have a great sex. There is nothing wrong in that.
But the
If
hankering is of having the sex like they had it under the influence of the substance because that
that
was
is
perceived as great.
great. So that shift of paradigm and focus is the part of treatment. Because what happens is anything which is discordant with my head,
Hmm.
in reality, I'm drawn back immediately to that.
Right.
I did not have a good sex. Now, I take an example multiple partners. You are not having the same experience with all of them. It may be different.
Right. Right.
But in your head, what are you looking at?
Hmm.
Now, if it is different and you still enjoying it, then you don't go back. The question still is,
Right.
what is one looking for? If he gets
Yes.
it, nothing better. And if he gets it without substances, it is even better. How often sorry, people use sex enhancers. वो वायग्रा खाने का है मेरे को. मैं बोला क्यों भाई?
Hmm. Hmm.
अगर वही चीज बिना शराब से हो सकती है, तो why do you
Hmm.
need Viagra? And they don't believe
Right.
you to begin with. It is only when they go through the experience and they feel surprised. Yeah, this is possible. And these are the people who go for a long term recovery programs. And still,
Correct.
trust me, the one part which is most difficult into treatment of any addictive problems is addictive logic of that person.
Correct. So whether
Yeah,
it is we are looking at heterosexual partners for sex, or whether we are looking at same-sex partners for sex, the idea is to resolve the conflict in one's individual mind,
that's
because
right.
that is the issue. It is neither sex nor sexuality. The issue is the conflict that is created as a result of that in one's own individual mind, and that is what requires help. So, thank you, sir, for identifying that moot point over here, wherein that is exactly what we need to be doing. In therapy, also, even we at Anatta, we aim at getting our clients to first identify what is the conflict, and then helping that person arrive at his or her own individual answers. And
Yes,
wherein, because where sex and sexuality is concerned, concluding our talk, sir, now, that where sex and sexuality is concerned, it is very essential to also incorporate the partners into the conversation in where resolving sexual conflict is concerned.
yes,
Now, the
that
partner
is
can be the spouse or not the spouse also. Many
right.
times when people do have close relationships with multiple partners. However, the idea here is to aim to treat the individual who has come to us and the loved ones that are there, or the, let us say, the significant others in that individual's life. So
Yes,
the aim of therapy in Anatta, and in should be in any therapeutic process where addiction is concerned, is to enable that person to live the best life that person can live, providing the right kind of tools to resolve conflicts, which are always emotional in nature,
yes.
and also guiding the person to receive help and ask for help when required. So would you like to add anything else onto this?
No, but one thing which I cannot resist myself, the addictive logic will take them the shortcuts.
Correct.
So what happens is that I can't perform, and therefore I take tablet and it works. Likewise, there are people who would give medicine to take care of alcoholism, which,
Yes.
if one is not working with the patient and only with the medicines, I personally believe that it's not going to resolve any conflicts. Or sooner or
Correct.
later, there will be multiple relapses in that person because he doesn't want to listen.
Understandable.
He doesn't want to make a change. And
Correct.
that's how it,
That
that's the limitation.
unfortunately,
Yeah,
I understand. I understand. That is where the experiential counselor also comes in, wherein the client, the experiential counselor, and the professional help that particular individual
correct.
interchangeably or together to get motivated to receive help and to accept
Right.
help for that person's individual addiction and conflicting life situations. So that is where the residential program comes in, wherein we live with the client, being available to that person
Available.
and that
Yes.
person's available, being available to that person and that person's family through our family therapist, to build bridges and to enable this person who has been a particular way in his or her life to receive help and to see a life beyond substance use. So,
I
concluding
would
our
say,
session,
sorry, one more comment.
yes, yes,
That
yes,
it is not enhancing the well-being of the client. It is in totality picture. It is his partner or friend or whatever sexual partners or family members. We are giving support system to all of them. Help is
absolutely,
available. Help is available when you want it. That should be the
absolutely.
principle. Yeah,
That is the
great.
principle. Thank you, Dr. Jerajani. And with that, we conclude our session today of
My
Anatta.
pleasure.
Thank you.
Thank you very much. Thank
Thank
you,
you.
all of you.
Yes.